Hello, my name is Chloe Rosero. I decided to do my senior project of spring 2024 on soy isoflavone intake and breast cancer risk. The reason why I chose this topic was because I myself eat a lot of soy on a day-to-day basis, such as soy sauce and tofu and edamame. And because of this high consumption, I was actually warned about possible adverse outcomes, such as increased risk of breast cancer. And upon further investigation, I found that there's a lot of controversy around this topic, which prompted me to write a literature review investigating it further. To reiterate, I chose to do a literature review that investigated the possible relationship between soy consumption and supplementation on breast cancer risk and prognostic outcomes. And the reason why is because to add on as to why is because 1 in 8 women in the US will develop breast cancer in their lifetime. And strikingly so, 2.3 million women are diagnosed with breast cancer globally. These statistics show the prevalence of breast cancer and how modifying any risk factors like lifestyle and dietary habits with dietary interventions can reduce the cost of breast cancer treatments and give more people more awareness on what they can do on a day-to-day basis to reduce their risk. In addition, we know that soy isoflavones mimic the structure of human estrogen, specifically 17-beta-estriadol, and because of this, might have an effect on breast cancer risk and outcomes. The reason why we look at soy isoflavones in particular is because of their similar to structure to estrogen, as estrogen in high levels is associated with higher risk of breast cancer due to proliferative effects and inflammation that it has. And the way that soy isoflavones can modulate breast cancer risk is because specific isoflavones such as genistein and daidzein might be protective against breast cancer by modulating the activity of steroidogenic enzymes from converting estrogen and precursors to estrogen. They may also change how estrogen is processed in the body by reducing harmful forms of estrogen and increasing the less active forms. Lastly, isoflavones can compete with human estrogen by binding with estrogen receptors, suppressing the transcription of genes involved in cell proliferation and inflammation. Despite these possible beneficial effects, there are inconsistent findings despite the growth in research. In this literature review, we focused on 2 prospective cohort studies and 3 randomized control trials. So the first 2, Ho et al. And Tuyat et al. Are our prospective cohort studies. In our first study, we found that moderate soy intake decreased risk of all-cause mortality, breast cancer-related mortality, and recurrence in female breast cancer survivors of Hong Kong Chinese descent over the course of 6 years. Second, Tuyat and others found soy supplementation led to a 22% reduction in risk of estrogen receptor positive breast cancer and doubled risk of estrogen negative breast cancer, specifically in cancer-free French women under 50 years old over the course of 11 years. Onto our randomized control trials, Liu and others found that soy supplementation led to a significant decrease in fibroglandular tissue and the percent of the same biomarker, and also found that increased calcium levels increased both markers in premenopausal women over 2 years. And Kahn and others found that soy supplementation significantly increased Ki-67 index and the expression of 14 of 28 genes related to proliferation, apoptosis, and the estrogenic effect in high-risk women 25 to 55 years old. And the reason why we looked at Ki-67 index is because the higher that they are scored on this index, the higher the risk of breast cancer. And then lastly, Del Monte and others found no statistically significant associations regarding soy isoflavone supplementation and mammographic density in postmenopausal women with history of breast cancer. Overall, the general consensus is that soy isoflavone intake and supplementation has little to great beneficial effect on breast cancer risk. However, women at high risk for breast cancer, such as those with a family history of it, have reproductive conditions that instigate higher levels of estrogen, or even hormone therapy, such as women who are on who have symptoms of menopause and thus go on hormone therapy receiving estrogen. All of these populations are at higher risk for breast cancer and should be cautious of soy intake. And the other thing to note is to consider the type of breast cancer, such as estrogen receptor positive versus negative breast cancer, before recommending soy isoflavone supplements because they have opposing effects. Now, the strengths that I found in the literature review is the use of strong study designs, randomized control trials, and prospective cohorts, for example, and they had a robust number of participants. Another strength is the exploration of menopausal status among the studies. However, I did note some limitations, such as study selection bias. For example, there's only one study that looks at soy food consumption, and the other four, looked at soy supplementation. And there's also limited research regarding ethnicity. So for example, one study looked at Hong Kong Chinese women and another looked at French women, and the other three did not specify their population ethnicities. And then as far as future directions go, dosage and frequency of supplementation should be further investigated, as the dosage varied among the randomized control trials, and the frequency at which they took the supplements, whether it was 3 days per week or 5 days per week, varied. And the other variation that can be explored further is the ideal ratio of certain isoflavones within supplements, such as the ratio of isoflavones daidzein, genistein, and glycine. And lastly, menopausal status should be looked into further. In conclusion, soy intake and supplementation can reduce breast cancer and lead to positive prognostic outcomes. However, women at higher risk for breast cancer should be cautious of intake, and the type of breast cancer should be determined before recommending supplementation. Thank you.